Pregnancy 101, Part 8. We are moving on from myths and misperceptions about miscarriage to myths and misperceptions about stillbirth. Now, one thing we have to start off with is what's the difference? What's the difference between miscarriage and stillbirth? In the U.S., I can't speak to other countries, but in the U.S., basically it has to do with whether your loss is before 20 weeks or after 20 weeks. After 20 weeks, we say a stillbirth. Another very important distinction is when the developing individual has passed beyond the age of viability, meaning it's possible that they could live on the outside. Based on research, based on the textbooks that I teach from, that's currently known to be between 22, 26 weeks. And so not right at that 20-week mark here, but certainly a lot of people get more upset when you have a stillbirth. It's later on, more people are more comfortable, thinking of that's a baby. Maybe they had a chance of surviving. All right, so let's talk about the causes of stillbirth. Have on the green screen this website. If you just Google causes of stillbirth, first hit is from NIH and what are possible causes of stillbirth. It does do a pretty good job in sort of everyday, manageable language, listing out some causes. Some of them are similar to what we talked about before with miscarriage. All right, so pregnancy and labor complications. Pregnancy is complicated. Childbirth is complicated. There's just so many opportunities for things to go badly. And so these things include preterm labor, pregnancy with multiples, that makes things more risky, placenta problems, separation from the placenta, a placental abruption. And in addition, things we already talked about, like birth defects, possibly from chromosomal abnormalities or other types of birth defects that can be caused by a variety of factors. That would be a whole other lesson. These can contribute to stillbirth. And then infection, again, different infections may be more relevant early versus later in a pregnancy. And this is a big one for later in the pregnancy, problems with the umbilical cord. Umbilical cord incidents, they can lead to harm to that developing individual. And high blood pressure. People who get prenatal care, typically they're going to have to do those tests of their blood pressure to see if they're developing this very risky condition. And then other medical complications. Now, this website does acknowledge that financial, emotional, or other personal stress and smoking, tobacco, and marijuana are also linked to stillbirth. I do want to acknowledge stillbirth can absolutely happen for a variety of reasons, many which have nothing to do with any of the actions of the person who is pregnant.